It's no secret that kids like to have fun, but for kids with asthma, playtime can be difficult. We sat down with pediatric specialist Dr. Hovig Artinian to learn more about asthma in the Valley and what parents can do to keep their children healthy and active. Valley residents know asthma all too well.
So unfortunately here in the Valley, it is the highest rates in the state for asthma. We have about 1 in 6 kids who have asthma, and about 20% of school-aged children will have asthma here in the Valley.
A chronic condition in which the airways narrow and swell, asthma can cause difficulty breathing and can even trigger coughing, wheezing, and shortness of breath.
A lot of times you'll see us call it reactive airway disease when they're infants because there's a chance they might outgrow it. And so that's where we ask other questions related to their family history or other findings like eczema on their skin. And so there's some kids who are at higher risk of not outgrowing it. And in those kiddos, we'll kind of convert to using the term asthma.
For most children, asthma can be easily managed, but for some, it can become life-threatening, especially if it's untreated.
And so if you've got a kiddo who is coughing all the time when they're trying to play, and they're obviously not sick in any other way, but they're just trying to play outside and they're having especially a dry cough, or they feel short of breath or chest tightness, or if you hear wheezing frequently, these can all be signs of asthma. And so one of the best ways to tell the difference is, has this been going on for like 6 months and they're otherwise fine? That's probably not an illness. There can be children where their symptoms are only when they're sick or only when they're playing sports. And so we also have treatments that we can tailor and really specify for each child.
Dr. Hovig Artinian encourages parents to get in touch with their pediatrician to learn more about resources and treatments available for children battling asthma.
Think of asthma treatments as a ticket to give your child a chance to play, be active, so that you worry less. Because our goal is that when they get sick, because every kid's going to get sick, that their airways will have enough space for air to flow.